Moving on to the parasternal long axis view in cardiology convention, we're going to start by placing the transducer to the patient's left of their sternum along the internipple line. That's our starting point there. And we're going to look for a beating structure on the screen. And then we're going to consider moving to the interspace above and below just to see if there's potentially a better view. Now, while you do this, you want to keep the transducer essentially in a perpendicular position. We'll be adjusting and modifying afterwards, but first want to just obtain the best intercostal space. Once you're satisfied that you're at a good intercostal space with good views, you're going to ensure that you're rotated to the patient's right shoulder. And this should give you the longest axis of the heart. In this case, the left ventricle will no longer have the apex on the screen, and the LV will be long from screen left to screen right. Now, this is going to be different from patient to patient, so you can consider rotating the transducer clockwise, counterclockwise to see if the ventricle gets smaller, and then back in the other direction again until it gets long again to make sure you're in the longest plane. Secondly, you're going to use fanning to try to get a clear cut through the left ventricle with no papillary muscles in view, and ideally a crisp endocardial border both at the level of the septum as well as the far left ventricular wall as seen here. Finally, you want to make sure you have a view of the right ventricle, the aorta with the aortic valve, and the left atrium with the mitral valve in view as seen in this image currently presented. This is an example of an adequate parasternal long axis view.